what is the true cost of smoking and tobacco addiction to the economy and the healthcare system in the Philippines?
Okay. Well, let us look at this way. Okay. Combustible tobacco accounts for 7 million preventable deaths worldwide annually. Okay? Many prematurely. This is the data from the World Health Organization. Okay? An additional 1.2 million are estimated to die from being exposed to secondhand smoke. So smoking indubitably has direct and indirect impact to the economy, including, of course, healthcare expenditures, productivity losses, disabilities, absenteeisms, and early deaths. Okay. Now, at the level of the individual smoker, okay, a part of his income is diverted away instead of it being used for more important family needs, such as food, clothing, and health. To top it all, our discussion like this, 80% of the 1.2 billion smokers in the world live in low and middle income countries like the Philippines. Another World Health Organization data. Okay, our country is one of the 15 countries in the world heavily laden by tobacco-related diseases. Imagine 117,700 Filipinos are dying from it annually. It's
That's
actually costing the
incredible.
country. Yeah. It's actually costing the country 188 billion. That's or US dollar 4 billion every year for healthcare expenditures and lost income. And this is only based on four of the more than 40 smoking-related diseases, namely lung cancer, COPD or chronic obstructive pulmonary disease, heart disease, and stroke. If we include the cost of losing a loved one and all the other more than 40 smoking-related diseases, the losses is estimated at about 270 billion in the revenues annually. See, it's so big.
It's much more than COVID.
Yes. If you can just divert this and use this for our universal healthcare, no? And then if we can save, we can check or lessen the smoking prevalence and save this and divert this to universal healthcare or improve our healthcare system, which is in dire need of improvement. It would be very good, right? With this in mind, tobacco control is not only a public health priority, okay? But this is also a key development issue which affects overall quality of life and well-being. It should be dealt with vigorously and with exigency. We cannot tarry or dilly-dally too long because in our actions as the stakes are too high and the cost to life and economy are too much to be complacent about. I think maybe Tiki can add on to this, but that's my take for that question.
No, I think you said it perfectly. It's not just the health costs,
Yeah.
but the cost to the economy, to sort of families of smokers in terms of secondhand smoke, productivity losses, etc., etc. So yes,
Yes,
absolutely
that's
agree.
right.